Aqui está o texto puro do roteiro. Stop scrolling for just 60 seconds, because what you are about to hear in the next few minutes could genuinely change or even save your life or the life of someone you love deeply. If you are over 60 years old and you have ever stood up from your chair and suddenly felt the room tilt sideways, or walked down a hallway and felt like the floor was gently rocking beneath your feet, or woken up in the morning with that strange, foggy spinning sensation that you just could not quite explain, please do not brush it off. Do not tell yourself it is just tiredness. Do not assume it is something you simply have to live with because of your age, because it might not be. And by the end of this video, you will understand exactly why dizziness after 60 deserves serious, urgent attention. The causes your doctor might not immediately think to mention. The warning signs that separate harmless lightheadedness from something far more serious, and the specific steps you can take starting today to protect yourself or someone you care about. Right now, before we go any further, do one simple thing. Hit that subscribe button and turn on the notification bell. Every single week, we bring you research-backed, clearly explained health information designed specifically for people over 60, not the generic stuff, the real, practical knowledge that helps you live better, longer, and with more confidence. Subscribe now, and let's get into this together. Let's start with something personal. Imagine your mother, or your father, or maybe it is you. You are standing in the kitchen one morning, making coffee, and all of a sudden the counter seems to shift. You reach out to grab something solid. Your heart beats a little faster. You wait. After a moment, it passes. You take a breath. You tell yourself, I'm fine. It was nothing. But here is the thing nobody tells you. That moment, that brief, dismissible, easy to ignore second of dizziness is one of the most common reasons adults over 60 end up in the emergency room. Not because dizziness itself is always dangerous, but because the things that can cause it, when left unaddressed, can be. Dizziness is not a disease, it is a symptom, and like all symptoms, it is your body's way of sending you a message. The question is, are you listening? According to research published in health and aging journals, dizziness and balance problems affect approximately 30 to 40% of adults over the age of 65. That is nearly 1 in 3 people, and yet the vast majority of those people never bring it up with their doctor. They normalize it. They adapt their lives around it, holding walls when they walk, avoiding certain head movements, getting up more slowly, quietly giving up activities they used to love. That quiet giving up, that slow shrinking of life. That is what we are here to talk about today, because it does not have to be that way. The word dizziness is actually an umbrella term that covers several very different experiences, and distinguishing between them is the first important step toward understanding what your body is trying to tell you. The first type is called vertigo. This is the sensation that either you or the world around you is spinning or moving, even when you are completely still. It can be sudden and intense, or mild and intermittent. People often describe it as feeling like they are on a merry-go-round that won't stop. Vertigo can last seconds, minutes, or in some cases hours. It is frequently accompanied by nausea, sometimes vomiting, and an overwhelming need to hold very, very still. The second type is lightheadedness, that woozy, floaty, almost pre-faint feeling you might get when you stand up too quickly, or when you have not eaten enough, or when your blood pressure dips unexpectedly. It feels less like spinning and more like the world is slightly unreal, slightly distant, like you are watching yourself from just outside your own body for a moment. The third type involves what doctors call disequilibrium, a sense of imbalance, of being unsteady on your feet, of needing to concentrate more than usual to walk straight. This one often shows up without any spinning or lightheadedness at all. It is just a persistent feeling that your footing is unreliable, that the ground beneath you cannot quite be trusted. And then there is a fourth category, less precisely defined, that patients often describe simply as a general feeling of being off. Not quite dizzy, not quite lightheaded, just somehow not right. Foggy, disconnected. Like something inside the machinery of your body is running just slightly out of alignment. Each of these types of dizziness can have very different causes, and identifying which one you are experiencing is one of the most useful things you can do when you talk to your doctor. Now, let's talk about what is actually happening inside your body when you feel dizzy, because there are several causes that are extremely common in adults over 60, and some of them are far more serious than most people realize. Despite its intimidating name, BPPV is actually the most common cause of vertigo in older adults, and in many cases, it is treatable. BPPV happens when tiny calcium crystals in your inner ear, crystals that are supposed to help you sense gravity and movement, become dislodged and drift into the fluid-filled canals of your ear where they do not belong. When you move your head in certain ways, rolling over in bed, looking up at a high shelf, bending over to pick something up, these misplaced crystals tumble through the wrong canal, sending confused signals to your brain. Your brain receives movement data that does not match what your eyes are seeing, and the result is that unmistakable, disorienting spin. The good news: BPPV is frequently resolved with a specific series of gentle head movements called the Epley maneuver, which a trained physical therapist or doctor can guide you through. Sometimes just 1 or 2 sessions. Many people experience complete relief. The important thing is getting diagnosed, because BPPV can be mistaken for far more serious conditions, and it can also exist alongside them. Your vestibular system, the complex network of fluid-filled canals in your inner ear that tells your brain where you are in space, is remarkably sophisticated. It is also vulnerable. A viral infection can inflame the vestibular nerve, a condition called vestibular neuritis, causing sudden, severe vertigo that can last days. A related condition, labyrinthitis, involves inflammation of the inner ear itself and can additionally cause hearing loss or tinnitus, ringing in the ear. These conditions are typically temporary and treatable, but they can be quite alarming when they first occur, especially if the dizziness is intense and sudden. If you experience sudden, severe vertigo that comes without warning and does not quickly resolve, you should seek medical attention promptly. Here is where the conversation becomes more urgent. In adults over 60, dizziness, particularly lightheadedness or near fainting, can be a direct signal from your cardiovascular system. When your heart is not pumping blood as effectively as it should, or when your blood pressure drops suddenly, a condition called orthostatic hypotension, your brain does not receive adequate blood flow. And your brain, sensitive and demanding organ that it is, communicates this shortage in the most immediate way available to it, by making you feel unsteady, foggy, or on the verge of losing consciousness. Orthostatic hypotension, that dizziness you feel specifically when standing up, is particularly common in older adults, and it is associated with an increased risk of falls, fainting, and even cardiovascular events. It can be caused by dehydration, certain medications, underlying heart conditions, or nervous system disorders. Atrial fibrillation, a common heart rhythm disorder in people over 60, can also manifest as dizziness. So can narrowing of the arteries that supply blood to the brain. So can heart valve problems. If your dizziness comes with chest pain, shortness of breath, an irregular or racing heartbeat, or a feeling of pressure or tightness anywhere in your chest, please do not wait. That is not a situation for a scheduled appointment next Tuesday. That is a situation for emergency care today. This is the one that most people are afraid to say out loud. So let's say it clearly and calmly. Dizziness can, in some cases, be one of the warning signs of a stroke or a TIA, a transient ischemic attack, sometimes called a mini stroke. A stroke occurs when blood supply to part of the brain is suddenly cut off. The symptoms depend on which part of the brain is affected. When the cerebellum, the part of the brain that controls coordination and balance, is involved, dizziness, sudden difficulty walking, loss of coordination, or severe vertigo can be among the primary symptoms. The critical distinction: stroke-related dizziness typically comes alongside other neurological symptoms, sudden weakness or numbness on one side of the body, sudden difficulty speaking or understanding speech, sudden vision problems, sudden severe headache with no known cause. Remember the acronym FAST: face drooping, arm weakness, speech difficulty, time to call emergency services. If dizziness appears alongside any of these warning signs, treat it as a medical emergency. This one is enormously common in adults over 60, and it is talked about far too rarely. Many of the medications most frequently prescribed to older adults, blood pressure medications, antidepressants, sedatives, antihistamines, diuretics, some diabetes medications, certain antibiotics, list dizziness as a side effect. And when someone is taking multiple medications simultaneously, which is very common in this age group, the interactions between those medications can cause or worsen dizziness significantly. If your dizziness began or noticeably worsened after starting a new medication or changing your dose, that is information your doctor needs. Do not simply tolerate it. A medication adjustment might resolve the problem entirely. As we age, our sense of thirst diminishes. Many older adults are chronically mildly dehydrated without knowing it because they simply do not feel as thirsty as they used to. Dehydration reduces blood volume, which reduces blood pressure, which reduces blood flow to the brain, and dizziness follows. Deficiencies in certain vitamins and minerals, particularly vitamin B12, vitamin D, and iron, can also contribute to dizziness and balance problems. These deficiencies are extremely common in older adults and are detectable with a simple blood test. The connection between psychological states and physical dizziness is real and well documented. Chronic anxiety can cause hyperventilation, even mild, barely noticeable hyperventilation, which alters the levels of carbon dioxide in your blood and produces dizziness, lightheadedness, and a floating sensation. Panic disorder, generalized anxiety disorder, and even chronic everyday stress can all manifest physically as dizziness. This is not all in your head in a dismissive sense. It is a genuine physiological response, and it deserves the same attention and care as any other cause. We are about halfway through, and I want to pause for just a moment. If anything you have heard so far has made you think about yourself, about a parent, about a spouse, about a friend, I want you to do something right now. Leave a comment below this video. Tell us, have you or someone you love experienced unexplained dizziness? How long did it take to get answers? Your story matters. Your experience might be exactly what someone else watching this video needs to hear to finally take action. We read every single comment, and this community of people supporting each other through these conversations is one of the most powerful things we have built together here. So share your thoughts below. And if this video is reaching you and you haven't subscribed yet, this is your moment. Hit that button and join us. Let's talk about falls, because dizziness and balance problems in older adults are not just uncomfortable, they are dangerous in a very concrete, very serious way. Falls are the leading cause of injury-related death in adults over 65. Each year, millions of older adults experience a fall, and a significant percentage of those falls result in fractures, head injuries, and complications that permanently alter quality of life. Hip fractures, in particular, carry a sobering prognosis. A significant percentage of older adults who suffer a hip fracture never fully regain their prior level of independence. And what is one of the leading contributors to falls? Dizziness, balance problems. That unsteadiness we have been talking about this entire video. This is why every episode of Dizziness deserves attention. Not alarm, not panic, but serious, considered attention. Because the stakes are not abstract. They are as concrete as a hospital room, a rehabilitation facility, a life that looks smaller and more limited than it used to. The encouraging reality is that many falls are preventable, and many of the conditions that cause dizziness, when addressed promptly and properly, can be significantly improved or even resolved. This is not a situation where you simply accept declining balance as the cost of getting older. This is a situation where knowledge, action, and the right medical care can make an enormous difference. One of the most common things we hear from people in our community is some variation of this. I mentioned the dizziness to my doctor, and they didn't seem concerned. Or, I wasn't sure how to explain it, so I just said I felt a little dizzy sometimes. Or, most heartbreakingly, I didn't bring it up because I didn't want to seem like I was overreacting. You are never overreacting when you advocate for your health. Let's be absolutely clear about that. But it is true that how you describe your symptoms to your doctor can significantly impact the quality of care you receive. So here is a practical framework for having that conversation. First, describe the sensation as precisely as you can. Is it spinning, floating, unsteadiness, a sense of nearly fainting? Use the specific language we discussed earlier if it helps. Vertigo, lightheadedness, disequilibrium. The more precisely you can describe it, the better your doctor can narrow down the possible causes. Second, track the timing and triggers. Does it happen when you first stand up, when you roll over in bed, when you turn your head quickly, in the morning specifically, after meals, during or after exercise? Is it constant or does it come in episodes? How long do the episodes last? Seconds, minutes, hours? All of this information is diagnostically useful. Third, list all medications you are taking. Prescription and over-the-counter. Include supplements, vitamins, and herbal remedies. Your doctor needs the complete picture to identify potential contributors. Fourth, mention associated symptoms. Any recent changes in hearing, ringing in the ears, headaches, vision changes, chest symptoms, difficulty with coordination or walking. Have you fallen or nearly fallen? Fifth, and this is important, be honest about the impact on your daily life. If you have stopped driving because you are afraid of a dizzy episode, if you hold the wall when you walk, if you avoid certain activities, your doctor needs to understand not just the symptom, but what that symptom has cost you in terms of quality of life. And if your doctor is dismissive, if you feel your concerns are not being taken seriously, it is completely appropriate to ask for a referral to a specialist. A neurologist, an ear, nose, and throat specialist, a vestibular rehabilitation specialist, or a cardiologist may all be relevant depending on your specific situation. You are your own best advocate. Use that power. When your doctor takes your dizziness seriously, as they should, there are several diagnostic tools they might use to understand what is happening. A thorough physical examination will typically include checking your blood pressure in both sitting and standing positions to identify orthostatic hypotension. It may include the Dix-Hallpike test, a simple positional maneuver that helps diagnose BPPV. It will likely include a basic neurological assessment of your reflexes, coordination, and gait. Blood tests can check for anemia, B12 deficiency, vitamin D levels, thyroid function, blood sugar, and inflammatory markers, all of which can contribute to dizziness. An EKG can assess heart rhythm. A Holter monitor, a portable EKG worn for 24 to 48 hours, can capture intermittent arrhythmias that might be missed in a brief office visit. Audiometry can assess hearing function and inner ear health. Video nystagmography measures eye movements in response to specific stimuli and can help diagnose vestibular disorders with considerable precision. In cases where a neurological cause is suspected, an MRI or CT scan of the brain may be ordered. These imaging studies can detect structural abnormalities, evidence of stroke, tumors, or other neurological conditions that might be contributing to dizziness. The point is this: there are real, concrete, effective tools available to understand why you are dizzy. You do not have to simply accept the uncertainty. Answers are possible, and with the right answers come the right treatments. Here is something genuinely encouraging. The majority of conditions that cause dizziness in adults over 60 are treatable. Some are highly treatable. Some are completely resolvable. For BPPV, the Epley maneuver and related canalith repositioning procedures have remarkable success rates, often providing significant relief after just 1 or 2 sessions with a trained practitioner. Home versions of these maneuvers exist, and while they can be helpful, working with a professional initially is strongly recommended. Vestibular rehabilitation therapy, a specialized form of physical therapy, has strong evidence behind it for a wide range of balance disorders. A vestibular therapist guides you through specific exercises designed to help your brain compensate for inner ear dysfunction, gradually improving your stability and reducing dizziness. This is not passive treatment. It requires commitment and consistency, but the results can be transformative. For medication-induced dizziness, the solution may be as straightforward as adjusting a dose or switching to a different medication. This is a conversation worth having explicitly with your prescribing physician. Cardiovascular causes, orthostatic hypotension, arrhythmias, heart failure, are managed through a combination of lifestyle modifications, medication adjustments, and in some cases, procedural interventions. Increasing fluid and salt intake under medical guidance, compression stockings, specific exercise programs, and targeted medications can all help manage orthostatic hypotension. For dizziness related to anxiety, cognitive behavioral therapy, mindfulness-based approaches, and in some cases medication can be highly effective. There is no shame in pursuing mental health support as part of a comprehensive approach to physical symptoms. And for the dizziness that is genuinely related to aging itself, to the gradual decline in vestibular sensitivity and proprioception that happens naturally over time, exercise remains one of the most powerful interventions available. Regular balance training, strength training, and activities like Tai Chi have strong evidence for reducing fall risk and improving overall stability in older adults. The path forward is not resignation. The path forward is knowledge, action, and the support of people who take your experience seriously. Beyond medical treatment, there are practical daily habits that can meaningfully reduce dizziness and improve balance in older adults. Hydration is fundamental. Aim to drink water consistently throughout the day, not just when you feel thirsty. Many older adults do well with a daily target of around 6 to 8 glasses, though this varies by individual health circumstances. If you are on medications that affect fluid balance, ask your doctor what is right for you specifically. Rise slowly. When moving from lying down to sitting or from sitting to standing, pause at each position for a few seconds before proceeding. This gives your cardiovascular system time to adjust and reduces the blood pressure drop that triggers lightheadedness. Review your home environment with fresh eyes, specifically looking for fall hazards. Loose rugs, poor lighting in hallways and bathrooms, lack of grab bars near the toilet and shower. These are not minor inconveniences. They are real risks that can be corrected. Consider a formal home safety assessment with an occupational therapist if your balance is a significant concern. Limit alcohol. Even small amounts of alcohol affect balance and vestibular function in older adults more significantly than in younger people. If dizziness is a concern, alcohol is worth minimizing. Prioritize sleep. Sleep deprivation exacerbates dizziness and impairs balance. If sleep quality is poor, if you are waking frequently, snoring heavily, or never feeling rested, this is worth addressing directly, potentially including evaluation for sleep apnea, which is common in older adults and linked to numerous health concerns. Regular exercise, not aggressive, intense exercise, but consistent, appropriate movement, is one of the most powerful things you can do for your vestibular health, your cardiovascular health, and your overall resilience. Tai Chi, yoga, swimming, walking, gentle strength training, find what you enjoy and do it regularly. And finally, do not isolate yourself because of dizziness. The social withdrawal, the avoidance of activities, the quiet narrowing of life that dizziness can cause. This has real costs for mental and physical health. Community, engagement, purpose. These are not luxuries. They are medicine. If you are watching this video not for yourself, but for a parent, a spouse, a sibling, or a friend who you have noticed struggling with dizziness or balance issues, your role matters enormously. Older adults often minimize their symptoms to the people they love. They do not want to worry anyone. They do not want to seem fragile. They have spent decades being capable, self-sufficient, strong, and admitting to dizziness can feel to them like admitting something much larger and more frightening. Your job is not to alarm them. Your job is to make it safe for them to be honest, to listen without minimizing, to offer to accompany them to a medical appointment, to research together as you are doing now, to communicate clearly and lovingly that getting answers is not a sign of weakness. It is a sign of wisdom. It is a sign of choosing to protect a life that matters. Watch for the quiet signs. Holding walls, moving more slowly, avoiding activities they used to enjoy without explanation, becoming less willing to drive. These behaviors may not come with words. They may come as small, gradual changes that are easy to miss if you are not paying attention. Pay attention. Be present. Advocate for the people you love with the same fierceness with which you would advocate for yourself. Let's take a breath and bring everything together. Dizziness after 60 is common, but common does not mean normal. Common does not mean you simply have to accept it, and common absolutely does not mean harmless. Dizziness is a message from your body. It can come from your inner ear, from your heart, from your nervous system, from your medications, from your hydration level, from your mental state, from your nutritional status. The causes are many, and they range from easily correctable to genuinely serious. What they all have in common is this: they deserve attention, they deserve investigation, they deserve the care and respect of a medical team that takes your quality of life seriously. You have spent decades building your life, decades working, loving, learning, creating, enduring, celebrating. You have earned every year you are living right now. Do not let dizziness quietly take pieces of that life from you, pieces of freedom, of confidence, of joy, without fighting back with knowledge and action. The most important thing you can do after watching this video is simple. If you have been experiencing dizziness that you have not discussed with a doctor, make that appointment. This week, not someday, this week. Write down your symptoms before you go, using the framework we described. Be specific, be honest, be your own advocate. And if you have already sought help and felt dismissed, seek another opinion. Your instinct that something is wrong is worth taking seriously. You deserve a doctor who agrees. Before you go, I want to ask you something directly. If this video gave you something useful, a name for what you have been experiencing, a question to ask your doctor, a reason to finally make that appointment you have been putting off, please share it. Share it with your spouse. Share it with your adult children. Share it with a friend who has mentioned feeling dizzy and brushed it off. This information can make a real difference in someone's life, and you might be the person who puts it in front of them at exactly the right moment. And right here in the comments, I would love to hear from you. Tell us, what has your experience been with dizziness? What have you found helpful? What do you wish someone had told you earlier? What questions do you still have? Your voice in this community matters to us, and to every person who scrolls through these comments, looking for reassurance that they are not alone. If you are not subscribed yet, please do it now. Every week we create content like this: honest, researched, genuinely useful health information for people over 60 who deserve to age, not just with grace, but with power, confidence, and full information. Hit subscribe, hit the bell, and we will see you in the next video. You are not alone in this, and you are absolutely worth fighting for.